University of Limerick, Department of Nursing and Midwifery. Module Introduction to Psychology, PowerPoint about attachment, palliative care, the nurse's perspective. Project done by Paula Alves, Mace Gleason, Linda Arrington, Patrice Lynch, and Georgia Murphy. First year, second semester. Order of presentation. Introduction, responsibility of Macy Gleason. Attachment theories, Ul.Ie by Patrice Lynch. Attachment theories, Ainsworth by Georgia Murphy. Palliative care, the nurse's perspective by Paula Alves. Conclusion by Linda Arrington. Introduction. Our chosen topic for this presentation is about attachment theory and how it applies to the palliative care setting from a nursing perspective. In particular, we have focused on Mary Ainsworth and John Bowlby's theories. Attachment theory is concerned with relationships between humans. It is a deep and enduring emotional bond that connects one person to another across time and space. This theory was first formulated by John Bowlby. From a nurse's perspective, the death of a patient is a unique experience, and the time leading up to that may evoke emotional strain on the patient and the nurse. Nurses play a big part in providing physical, spiritual, and emotional care to the patient. Hence, becoming attached is almost unavoidable. Are based on interactions, which is especially seen in the palliative care setting. Attachment is generally associated with infants and their carers, but can also be applied to the healthcare. In this presentation, we will further outline how John Bowlby's theory of attachment and Mary Ainsworth's strange situation theory applies to palliative care in nursing. A bond is established after a period of time between patient and carer, making it difficult to maintain a professional relationship. This can impact on a nurse's care given, their family, and the patient. When the nurse attempts to avoid getting attached to a patient, ineffective care may be given. Introduction to Bowlby's and Ainsworth theories. The attachment theory is based on the joint work of Bowlby's and Ainsworth in the beginnings of the 1930s. The origins of the theory came from Bowlby's interest in the link between maternal loss or deprivation and Ainsworth's interest in security theory. The theory is based on the social and emotional bond developed between infant and caregiver during the first year of life. John Bowlby. Biography. Edward John Bowlby, born in London, was British psychologist, psychiatrist, and psychoanalyst. In the 1930s, worked as a psychiatrist in a child guidance clinic in London, where he treated emotionally disturbed children. This experience led him to consider the importance of the relationship between child and the mother in the terms of social, emotional, and cognitive development. This experience led Bowlby to develop his attachment theory. The origins of the attachment theory. Bowlby explains the intense distress experienced by infants who had been separated from their parent and create an interaction model of attachment. Bowlby looked at attachment behaviors as based on mutual interactions. Bowlby's theory emphasized the role of the mother in child development, where the father plays a second handle in the mothering. Bowlby outlines how separation causes extreme distress in children and the long-term adverse effects on the children as a result of even relatively brief separations. Attachment in children. The social and emotional bond between the infant and caregiver. In Bowlby's theory, he looks to the advanced behaviors of the infant. He explains that sucking is not just for nourishment but to relieve distress, how cuddling is to seek comfort, and looking is for a source of safety and connection. Smiling and eye contact is very rewarding for the parent, and crying is a way of teaching the parent. When parents imitating the infant's expression while vocalizing the emotion implied by the expressions helps the infant associate the emotion with their expression and makes them feel validated in their own emotions as a parent shows approval. For instance, when you smile to a baby and he smiles back, that's the reflection of mutual connection and mutual attachment. Bowlby also suggests that a critical period for the formation of detachment is between 6 and 24 months. The next graphic explains the 4 stages of attachment. We choose this graphic because it's very synthetic and has the main points. So the first occurs from birth to 6 weeks of life of the child and is called the pre-attachment. In this stage, baby shows no particular attachment to specific caregiver. The second is indiscriminate, occurs between 6 weeks to 7 months. In this stage, the infant begins to show preference for the primary and secondary caregivers. We have to understand that the primary and secondary caregivers are the mother and the father for the most of the cases. The second is discriminate and occurs after 7 months. The infant shows strong attachment to one specific caregiver. This stage is where the child develops a strong bond with the first caregiver, usually is the mother. Is not only depending on the mother for comfort, food, and other instant necessities, but is also develop a relationship of affection, sense of humor, etc. The last stage is the multiple. It occurs after 10 months. It's the growing bond with other caregivers. It's when the child starts to recognize other family members or close friends. And the recognition is mutual. This means that the child is able to identify the other multiple caregivers that have a strong connection, emotional connection, and a caring connection with the child during this stage. Mary Ainsworth, biography. Ainsworth studied at the University of Toronto, where she was introduced to security theory by William Blatz. In London in 1950s, she took a position in research under Bowlby. Ainsworth's first study, the Granda Project, was an observational study which began when she moved to Uganda in 1953. She decided to observe the development of infant-mother attachment. In 1963, Ainsworth embarked on the second observational study called the Baltimore Project, in which she observed 26 families with infants aged 1 to 24 months. Remember, Bowlby suggested that this is the critical period for the formation of the attachment. She studied across 54 weeks and collecting approximately 72 hours of data on each family. 4 stages of attachment. The next picture represents the 4 stages of attachment. It's a very synthetic way of explaining the 4 stages of attachment. The first stage is called the security attachment. It's about the relationship that the child develops with the parents. If the parents behave and transmit positive emotions, the child will have a sense of security. This is called the security attachment. The second one is ambivalent attachment, where the child is wary of strangers. The third type is avoidant attachment, where the child may avoid the parents. The fourth stage is disordered attachment, where the child presents confusion or apprehension. Attachment theory of Mary Ainsworth. Projections in adulthood. As the previous picture describes, there are 4 types of attachment. As Ainsworth expected, infants explore more in the presence of their mothers than they would if their mother wasn't present, or if only an unfamiliar person was in the room. This is called the stranger situation. She was also intrigued by unexpected patterns of infant reunion behaviors, which Bowlby had theorized in his research on separation. The Ainsworth adult attachment classifications correspond to secure, ambivalent, and avoidance behavior. They reflect infant patterns at the conceptual level. The conceptual level be understood here as the development stages, as long as a child grown up. The different types of attachment impact directly the adult behavior and their relationship with others on the personal or professional level. The next graphic explains the projections in adulthood of the attachment theories. These projections are based on the development of the child and the relationship they have with their primary caregivers. In this situation, the parents. There are 4 types of projections: the authoritarian, the democratic, the neglecting, and the permissive. These different types of projections will have an impact on how the child behaves as an adult. For instance, the first one, authoritarian, where the relationship between child and parents is based on the low nurturance, low communication, the high expectations, and high control that the parents have over the child. In these situations, statistics say the child tends to be abusive and violent when she is grown up. The second one is the democratic projection. In this situation, the relationship between child and parents is based on high nurturance, high communication, high expectations, and moderate control from the parents to the child. In this situation, the child develops as an adult to be an authoritative. This means he has a reciprocal behavior. He can accept challenges and take challenges. The third one is the neglecting projection, where the primary caregivers, in this situation the parents, will have a relationship of low nutrients, low communications, low expectations, and low control. In this situation, the parent's relationship with the child is very much of a neglective mode. This means the parents are absent from the main stages and the main important decisions that they may have to do with the child during the development. The last one is the permissive projection. In this situation, the relationship between parents and child during their development is very indulgent. The parents will have a relationship of high nutrients, moderate communication, low expectations, and low control. That means the parents will allow the child to explore the world by themselves and will assess their own obstacles and overcome their own problems. So they are very permissive. Palliative care, the nurse's perspective, the impact of attachment styles in nursing. We're going to explain the relationship between attachment styles and the impact that will have on an adult on the professional level. In this case, the nurses. And we're going to relate the palliative care attachment theories to the nurse's profession. So research suggests that the attachment style developed during childhood affects adults' relationship and response to stress. Hawkins, 2006. Nurses play a major role in the delivery of palliative care services to patients in the end of life. A major component of their work focuses on the delivery of emotional care and support to patients and their families. Developing supportive nurse-patient relationships involves a complex process. one that consists of getting to know the patient through the effective use of communication skills in a variety of healthcare contexts. Styles. The nurse's role. First, we need to understand what is palliative care. Palliative care. Care. Care decisions, including open discussions about treatment options when diagnosed with a series of chronic illness and the importance of advanced care planning. A. Addressing overwhelming symptoms, for example, pain, shortness of breath, fatigue, nausea, loss of appetite, and difficulty sleeping. R. Recognizing psychosocial distress that may include anxiety, depression, fears, and spiritual tension. E. Emphasizing you with a focus on the entire person, including the family. There are four major categories from the perspectives of patients and nurses. 1. Forming a relationship of trust. 2. Being part of the family. 3. Self-caring along the journey of living and dying. 4. Enrich experiences. Responses reveal that a relationship of trust is formed and that the nurses are not only regarded as health professionals, but also become part of the family or a good friend. Nurses who develop trusting relationships demonstrate a holistic approach to caring, show their understanding of patients' suffering, are aware of their unvoiced needs, provide comfort without actually being asked, and are reliable, proficient, competent, and dedicated in their care. Having a sense of security is vitally important to patients who have limited life expectancy. Styles, stress and coping. We're going to present a case study by Hawkins, 2005. The location of this study was in 5 different hospices for a group of 84 nurses, and the aim of the study was to evaluate the stress and coping mechanisms impact of attachment styles. Note, the hospice nurses with a fearful or dismissing attachment style were found less likely to seek emotional social support. The nurses with a secure or preoccupied attachment style are more likely to seek emotional support. The nurses with insecure attachment style experience more stress than securely attached nurses. Stress has contributed to burnout, mental health problems, absence of work, recruitment difficulties, and poor health care delivery. A source of stress involves exposure to death and dying patients, so the nurse must deal with painful effects of loss, separation, and termination. Adults with a more secure attachment style are generally more resilient in stressful situations, experience greater emotional health, better work adjustment, and adopt suitable strategies for coping with negative effects. Individuals who had insecure attachment may be at risk for complicated bereavement experiences in life or long-term psychological and neurobiological responses. In conclusion, the primary caregiver's behavior and interaction towards an infant could affect and shape their expectations and interactions with others through their lives, depending on the attachment style that infants and young children have been exposed to their development, specific patterns of relationships that affect their responses to their adult relationships. In conclusion now, we understand that the nurse as a professional cannot be separated from the nurse as a person. Patients are extremely vulnerable and often nurses develop emotional closeness. Such relationships not only improve patients' physical and emotional state, but also facilitate their adjustment to their illness, easy pain, and can ultimately lead to a good dad experience. It is nurses' personal qualities and skills, which are embedded in these relationships, that constitute excellence in nursing care. Nurses also derive satisfaction and are enriched through the relationships. The end.